Welcome to Nyakibale Hospital, a 64-bed hospital serving a population of 275,000 patients. This is the emergency room, the newest addition to the hospital. It has 3 beds. It has an ultrasound machine. It has medications that it keeps stocked on its own. It has an eye chart. It has all of the facilities for sterilization, for suturing. It has an extensive library. It has a orthopedic station manned by David, the orthopedic technician, clinical officer, and Felista, who is the one of the heads of the emergency room committee. And they also have 3 beds here, and some days they can have 15 or 30 patients waiting. Today's a nice quiet day, so they can relax. Moving on, we have the male medical ward, which has roughly 20 to 30 beds, different patients in recuperation. Families are visiting now. Here's one of the student nurses providing the medications. We also have an isolation ward. Down in this area, the patients are brought foods by their family. Coming along further, we have a corridor down to the female ward. This is the female medical ward, where you have people lying in. There's about 20 beds here. Here's some of the nurses doing a little consultation about diabetes. Okay, and then we return down the corridor again. You can see they have wheelchairs waiting in the corridor, like just about any hospital. By the way, the hospital emergency room has been named the Walsh Bizanzo Emergency Room. And this is where the senior matron stays. And here we have the pediatric ward. Everything is very convenient. 164 beds within walking radius of 20 feet. There's the pediatric ward, pediatric nurses, and all the children getting their treatments. There's actually 2 of these wards. And the families are all here, and they're all getting better. Changing area. And then another ward with all the families. Generational treatment. And this is the private wing where people get treatments as well. And people are bringing in their food, their water, because sometimes we're without water, seldom without food. And we're back into the main corridor of the hospital. We're now heading towards the surgical ward, which encompasses a number of post-op surgical patients, some of which we actually worked on today. Hello. And here they are. Here's one of the male student nurses taking his notes right before lunch. And we have all the patients here recuperating. And there's a female ward as well. Now we're going down the corridor again. As you can see, this is a central corridor with different wings. And here we are looking at the X-ray department. Unfortunately, the X-ray's been down, but right in front of the X-ray is the surgical theater, where the nurses are doing their notes, and there's actually a surgical procedure going on. Yes, you are on television now. And this is where the wounds are debrided. And this is where a lot of the cleaning, where the IV fluids are produced by some of the technicians here, producing the IV fluid. They make their own IV fluids here, D5W. And this is where some of the laundry is. And they're also cleaning the surgical supplies. So, and many times they have to get water from the well in order to do that. And here we go outside. It's always nice to be out in very salubrious weather. You can see the local village over here. So African hospitals, there's always an outside and an inside, and you kind of sometimes don't know the difference. This is the laboratory, and we'll knock on the door. This is where all the laboratory, this is Bernard, he's the head of the laboratory, and this is microscope, and all the students are working here, learning about the lab. He's an excellent teacher, and this will be on television throughout the United States.
All right.
And finally, we make our way to the maternity ward, which is actually the busiest ward in the hospital. Of course, a hospital would not run without administration, and that's the administration building there, where the doctors meet for morning report, where the administrator tallies up the budget and keeps the hospital running. It's extremely important. But the biggest ward here is the maternity ward. They do over 330 C-sections. They do over 6,000 deliveries. We'll just basically walk through it here. I'm not going to interrupt anybody in labor or anything like that. So here you have the waiting room and the general room. It's a long corridor, and many of these procedures, as you can imagine, are done in the middle of the night, and the women are recuperating here. And this is the nurse's station, even a nurse on duty, 2 of them, and some more women recuperating. And there's also a neonatal unit for the babies, which I believe there's an isolation ward. More patients waiting for either to have their babies, and this is the back part where some of the patients have their food prepared, and they have a little canteen, so it's quite nice. And that's the end of the tour of Nyakibale Hospital.